Hello, I'm Dr. Ronen Roy, Director of Orthopedic Surgery, Fortis Hospital, Anandapur. As all of you know, there are lots of things that you need to do after a knee replacement surgery to make sure that your recovery is uneventful. But I'd like to draw your attention to certain things you should not be doing during the early recovery phase, so to make sure that your knee surgery recovery goes as per plan. First and foremost, you should not overdo your exercises, as in the early stages this can actually lead to an increase in pain and swelling. So for example, if you start going out for a walk for half an hour immediately after your surgery, that is definitely not advisable. At the same time, it is important to ice the knee regularly and to make sure that you do your range of motion exercises at least 4 to 5 times daily to make sure that the knee does not become stiff. So staying in one position for a long time is not advisable. Another important thing is not to keep a pillow or a bolster behind your knee, because even though this may be comfortable, it will affect the ability to straighten the knee fully. So please do not put a support under your knee in the immediate post-operative period. Along with that, it's very important that you do not reduce your painkillers too early immediately after the operation. You may be worried that this may have an effect on your general health, but by and large, your doctors will be aware of what is safe for you. And if you don't take your painkillers regularly, it will affect your ability to do the exercises that have been prescribed on a regular basis, can delay or in fact adversely affect your outcomes in the long term. Another thing that patients think is that getting rid of a walker early is a great achievement. But let me assure you, that is not a fact. By and large, the walker is there for support and to make sure that you regain your balance and gait properly. So it's important that you use it for the prescribed length of time and not try and get rid of it too early, as your balance and gait is likely to be affected in the long term if you give it up too early. Finally, don't try and change your dressings at home, because an unsterile dressing can again lead to infection and other complications. If you're worried about your wound, please contact your physician or your operating surgeon and get it treated by the hospital itself. And most importantly, be guided at all times by your experienced physiotherapist, because they know exactly what needs to be done and ensures that your recovery in the post-operative phase is smooth and uneventful. I thank you for your attention.